Hi, my name is Roose. I'm a second-year pediatric resident with the UNLV Pediatrics program, and I'm here to tell you a little bit about my case presentation and the patient that we saw. So this is a 16-year-old female who presented to us. She just has a history of gastric emptying delay, but otherwise is pretty healthy. She presented to us with 3 days of burning sensation in her upper extremity and in her upper back, and so this had been intermittent over the past 3 days. It was relieved with NSAIDs, biofreeze cream, that kind of thing, but otherwise, no other symptoms coming in. So, but just to give you a little bit of background, she did have a history of about 8 months of having these intermittent numbness and tingling episodes happening in her bilateral upper and lower extremities, and for this she was being worked up by neurology, and so far everything neurology had done outpatient was negative, and that included some basic lab work, EMGs, that kind of thing. That was all negative. She was supposed to get an outpatient MRI done, but this wasn't really a possibility for her just because of insurance issues. So when she came to us, her physical exam, she basically everything was normal. Cranial nerves 2 through 12 were intact. She had normal sensation. She wasn't having that burning sensation at the moment when we were examining her. And the only abnormality on her neurologic exam was she had slightly diminished strength in her upper extremities, about a 4 out of 5, but otherwise was normal. So we admitted her to the floor and we did a brain MRI as well as cervical, thoracic, and lumbar MRIs. So the imaging came back. So as you can see here, this is her brain MRI, and there's a 2-centimeter lesion right about here on the left side of the genu of the corpus callosum. And this is the image of her cervical MRI, and as you can see here, there's some ill-defined lesions going on. They're pretty small, but you can see them here at multiple different segments. And then here in figure 3, we've got just one more image of her MRI. Her lesion is here on the left side of the genu of the corpus callosum. So she had a pretty substantial lesion in her brain. She had several lesions in her cervical spine, and she also had some lung lesions that were seen, and so we did a CT of her lungs and saw some gram-glass opacities in there. Because of these lesions, we had an infectious workup that was done, which was negative. We brought in our differential after we saw the images of her brain, and so that included MS, acute disseminated encephalomyelitis, and NMO. So we did send out for an NMO IgG, and this actually came back positive. The rest of her workup was negative. They did a lumbar puncture, and her CSF did not show any oligoclonal bands. So her diagnosis was made, and it is NMO, and NMO is within the umbrella of neuromyelitis optica spectrum disorders. So neuromyelitis optica spectrum disorders, it's a group of CNS demyelinating disorders, and it can involve demyelination of the spinal cord and the optic nerves as well. So it can present as vision changes, blindness, numbness, tingling, bowel and bladder dysfunction, hiccups, nausea, vomiting, that kind of thing. And the reason why it's so important to differentiate this with MS is that it has a different pathophysiology, it has a different biomarker, and some different treatments that we can do for that as well. So in terms of differentiating between MS and NMO, one of the main characteristic things for our patient was that she had lesions at multiple segments within her cervical spinal cord, and so that was our first clue that what she had is NMO. And so this disease, it causes stepwise deterioration with recurrent attacks, and so it's very important to identify this disease and to send these patients for proper treatment. And thank you for listening, and this is my presentation.